The principle around laser eye surgery is to reshape the cornea. We can use a surface technique, which is PRK. It's not as common anymore because it does take a little longer to heal compared to the more commonly used techniques, which is LASIK, and an even newer version of LASIK is RELEX Smile.
For the last 25 years or so, an ultraviolet laser has been the mainstay. A laser which, through billionths of a second pulses, removes millionths of a meter of tissue from the cornea. And these very, very fine sculpting procedures change the curvature of the cornea and the focusing power of the eye.
In a conventional LASIK procedure, the way that this laser works is it focuses its energy into the middle of the cornea to create a little bubble layer which is uniform across the cornea. That bubble layer can be dissected, much like a little postage stamp is connected with little perforations. It's easy to separate, and we can reflect that little bit of tissue, exposing the bed. It's the bed that's now reshaped using an excimer laser, and this is what changes the shape of the cornea to change the focusing of the light. We can return the flap, and the edges of the flap will heal in a few hours. The second type of procedure we offer is RELEX Smile. Here we only use a femtosecond laser. We don't need to use the excimer laser. And what the femtosecond laser will do is to create two planes, two interfaces within the middle of the cornea, again using the little bubble distribution. And we're able to, through a tiny 2mm surface opening, dissect through those bubbles, loosen the little lenticle, and remove it through the 2mm opening. The big advantage that RELEX Smile has over conventional LASIK is that we no longer have a flap, which gives us a little bit more biomechanical strength to the cornea, and also it means we're not interrupting many of the nerve fibers on the surface of the eye, which potentially means less dry eye in the early post-operative period compared to regular LASIK. So both LASIK and RELEX Smile take approximately 12 minutes. And that's of course treating both eyes. It's important always to remember though that the laser is only used for 20 seconds at a time. Most of the treatment is spent positioning, checking, double checking, making sure everybody's comfy as we move along.
The exciting thing about the latest development in laser eye surgery, which is this keyhole form of LASIK called Smile, is that someone could have a paper cut on their cornea or a scratch from their contact lens. As long as it takes for that to heal, that's how long the keyhole procedure takes to heal. When I say back to normal the next day, I mean back to normal. It's really quite miraculous.